So the topic of discussion today is S3 and S4. So let's learn the sequence of heart sounds and we will fit S3 and S4 in it. So first what happens is mitral and tricuspid valve closes, giving us a sound of S1. After S1, the aortic and pulmonary valves open, giving us a sound of ejection click. And when the aortic and pulmonic valves close, we will hear a sound known as S2. And after S2, mitral and tricuspid valves open, giving us a sound of opening snap. And again the cardiac cycle continues like this. Again S1, then S2, then S1, then S2. So you can see that from S1 to S2, the ventricle is in state of diastole. Here also, here also. So this period is the period of ventricle systole. So we can write from S1 to S2 is the period of systole, and the remaining period is the diastolic period of heart. Now what happens is when the ventricles are contracting, some of the blood remains in the ventricle after the contraction is over and after these valves have closed, aortic and pulmonic valves have closed, some amount of blood is still left in the ventricles, and this is known as end systolic volume. So and one more thing, that meanwhile the ventricles are contracting, the aorta is getting filled with blood from superior and inferior vena cava and here from pulmonary veins. So the aorta is also getting filled with blood, meanwhile the ventricles are contracting. So now what happens is when these valves open, the blood that was collected here suddenly gushes into the ventricle with such a pressure and with such a speed, and adding to the end systolic volume, this blood fills the ventricle, and this phase is known as rapid filling phase, because such blood is coming with such a speed because it was stored here. So from S2 to opening snap, this is a period of isovolumetric relaxation, and from opening snap to suppose this line, this is a period of rapid ventricular filling, to rapid filling phase. Okay, after rapid filling phase, what happens is now all of this blood which was stored in the atria have now gone into ventricles. So the pressure is now less in the atria, but atria is still filling with blood from superior inferior vena cava and pulmonic veins. So the blood from the superior inferior vena cava is directly coming into the ventricles. So the speed of blood is less compared to earlier when it was stored here for some time. So this is known as now slow filling phase, because the speed of blood is slow now, because it is not stored like earlier it was. So after rapid filling phase, we have a slow filling phase. Slow filling phase is known as diastasis. Okay, after diastasis, what happens is now the ventricles have blood from the rapid filling phase and ventricles have blood from slow filling phase. And now in a way you can see that pressure in the ventricles is more, pressure and volume in the ventricle is more than the atria. So now for the final part of the blood which has to be pushed into the ventricles, the atria has to contract in order to push the final blood into the ventricles. So what happens is here atria will contract, so it will be atrial systole here. You can see the ventricles are relaxed here, but atria is getting contracted. So during this diastole, ventricular diastole, here we have atrial systole. So I hope you got now that in the ventricular diastole we have isovolumetric relaxation, rapid filling phase, then diastasis, then atrial systole. Now let's talk about S3. Why do we hear S3 and when do we hear S3? So always remember that S3 we hear it in rapid filling phase. That is, here we will hear S3. And why we will hear S3? So as I already told you that in rapid filling phase what happens is that blood which was stored here suddenly gushes into the ventricles with speed. So what happens is the ventricle will get distended because of blood coming into it. So if more blood comes which comes usually. So if more blood comes, then ventricle will vibrate. It's a normal phenomena, but in most of the people it is silent. Like in normal population it is silent, but sometimes it can be heard. It is not silent and it can be heard giving a sound known as S3. So like in some physiological conditions also, like in some athletes it is heard, and in pregnancy also we can hear S3, especially in third trimester. So I hope you got that. S3 we get because of rapid filling of the ventricles, rapid filling in dilated ventricles, because when blood comes after the rapid filling phase, it dilates, the ventricles get dilated, and then when more blood is coming, then ventricles will zitter, or you can say vibrate, producing a sound known as S3. So in talking about pathological conditions of S3, S3 can be heard in congestive heart failure. Why? Because in congestive heart failure there will be volume overload, and over top of it the ventricles are not contracting properly, so there will be more end systolic volume in the ventricles, because ventricles are not contracting properly. The stroke volume will be less and end systolic volume will increase. So now these ventricles will be dilated even more because of the more end systolic volume, and now when the blood will come in rapid filling phase, we will hear an S3. And other condition is dilated cardiomyopathy. You know that ventricles are already dilated, and so blood coming in rapid filling phase will produce a sound S3. So, and a few more condition we can name is COPD and pulmonary embolism, because in these cor pulmonale occurs. Cor pulmonale, as we know, is the right ventricular failure due to non-cardiogenic cause. So due to this also S3 can be heard. So the cause of S3 is congestive heart failure, COPD, pulmonary embolism, and dilated cardiomyopathy. So remember these four important ones. So and remember the point that S3 is heard in rapid filling phase, and so it is heard in early diastolic phase. Like I will write S3 in here. So we hear it in early diastole. Now talking about S4. Why do we hear S4? Because suppose this atria is contracting. As we hear S4 when atria has to generate more pressure, and when atria has to contract vigorously in order to push blood into the ventricles. So S4 is always pathological, because atria will have to apply more pressure when either there is outflow tract obstruction, like in aortic stenosis, the walls are very stiff here and atria has to apply more pressure in order to push the blood out, or there is cardiac obstructive cardiomyopathy, hypertrophic obstructive myopathy. The ventricles are so stiff and hypertrophied that atria has to generate so much pressure. It has to contract so vigorously in order to push blood into the ventricles. Or in long-standing hypertension or pulmonic stenosis or long-standing hypertension, there is so much resistance here that atria has to generate so much of power in order to push the blood into aortic or pulmonic walls. So I hope you got that. And now let's discuss the causes. It is aortic stenosis, as we have discussed, and hypertrophic obstructive cardiomyopathy. But these two will cause left-sided S4. And pulmonic stenosis and pulmonary artery hypertension, they will cause right-sided S4. So remember that S4 is heard in late diastolic. It's a late diastolic sound. As we have seen in this diagram, it occurs in atrial systole. So I will draw S4 here in atrial systole. So you know that it is a late diastolic sound, and S3 is early diastolic sound. So thank you, that's it.